Hi, time for the next blog, and here I am on a beautiful Sunday afternoon down in Augusta, Georgia at Dwight David Eisenhower Army Medical Center, where I just finished a shift in the emergency room, and working here made me think about the next topic I'd like to discuss, and that's single payer, universal health care. Americans are starting to favor this concept, and 59% of Americans today support a single payer system, where a year ago last summer it was only 33%. And I think part of the problem that if there's an increasing expectation that this is a better system is where Americans are actually being misled, because it's not a better system. Senator Bernie Sanders, as you know, in the last election really promoted the single payer healthcare system, what he called Medicare for all. So all the employer-based insurances, individual insurances, Medicare, Medicaid, uninsured, everybody is thrown in one pot and is part of government-based health care. Estimated costs for this Bernie Sanders plan, $3.2 trillion per year, which will increase your payroll tax 7.5%. It'll increase your individual income tax 4%. I think that's probably a gross underestimation, because anytime the government gets involved, as we know, things get screwed up, costs triple, quadruple, and it's a lot more. States are considering establishing a single payer system. California Senate approved a plan for single payer, but it got to the House and got tabled because nobody knew how it was going to be paid for. It's going to be estimated cost of $400 billion a year for their single payer health care, which is twice what the state's current budget is. That doesn't sound like a smart move. The only way a government can do this and keep costs down is to ration health care. In other words, you don't always get it if you want it. It's when they decide you get it. And it's like the worst HMO that you can imagine being established. So how does this work for Canada? Because that's what they've got, universal health care. They have outlawed private insurance. You are not allowed to have it in their country. Patients wait months to get health care. It is an estimated 21 weeks, a median of 21 weeks from the time you see your primary care before you get to see a specialist for whatever problem's going on. The cost for the average Canadian family jumped 174% over the last 20 years. Twice what their income has increased, and 4 times the rate of inflation. Democrats are struggling to implement single-payer health care, while the Canadians who have it are struggling to get out. 75% of the Canadians surveyed said they want private insurance brought in. So that doesn't make much sense. So the reason I've established this, as I talked about, is military medicine, where I'm working today, an Army post, federal facility, is the universal health care. And seeing in the ER how people treat it. They come to the ER to get their refills because they can't get in to see their primary care doctor. Doctors are not incentivized. They get paid a salary no matter what you do. And so they don't want to work, they don't have to work any harder and see extra patients to try to generate income, because they know it doesn't do them any good. So patients come to the ER just to get prescription refills. They come to the ER to get an ultrasound or CT scan they've been waiting on for months and can't get, because the system is rationing the procedures and tests that are being done. Y'all know Liam Neeson, actor. His wife, Natasha Richardson, died in 2009 from an accident. I strongly believe that her accident is the result of single-payer health care, universal health care. She was in Canada, had an injury on a bunny slope, hit her head. She did delay some of the care herself, but when they established that something was going on with her, she's at a hospital that had no CT scan. They had to put her in an ambulance, drive her 45 minutes to another hospital before they can determine what's going on. She died from those injuries. She falls anywhere in the United States, she's still alive today. I honestly believe that. When I was in Rome last year, I asked the taxi driver, y'all have universal health care, what do you think about it? His response was, it's great if you don't need it. He had a pinched nerve in his back, and knew he required an MRI, needed surgery, and they told him minimum of 6 months before he would be seen. And so he simply paid $10,000 out of his pocket to get the procedure done and get it done sooner outside of the universal health care. So that's what you're looking for if you want universal health care. That's what you'll get. All right, got to finish it up right here. Lady walks into a pharmacy and tells the pharmacist, "I'd like some arsenic, please, sir." And he said, "That's a poison. I can't give you arsenic." And she's like, "I need some arsenic." And he says, "That is a poison. It's toxic. It will kill you." She says, "No, I want to kill my husband. Please give me some arsenic." He says, "Absolutely not. I cannot do that. I can't be liable for you trying to kill your husband. This is terrible." And she takes out something out of her pocketbook, a picture, slides it up on the counter in front of the pharmacist, and the pharmacist picks it up and looks at it, and he realizes it's his wife and this lady's husband in bed together. And he goes, "Oh, I didn't know you had a prescription." Thank you.